Have you ever met or been around someone who is really doing all the right things? They are showing up for work, they are taking care of the kids, they are smiling in all the pictures, but you just know that inside they feel like they're drowning, or even maybe that's you, like you feel like you're drowning on the inside and you really don't understand how to climb out of it. And one of the things I want to bring forth in this video is just talking about mental health. It doesn't always look like somebody crying in bed. Sometimes it can look like you snap at things faster than usual. And I know that many of us have been there. You feel numb to certain situations. You are overthinking things, maybe losing motivation for things that normally felt really fun and really exciting for you. It could be someone eating too much, or the other side of that, not eating at all or not eating enough, maybe sleeping all day, or again, the other side of that, not sleeping at all. And oftentimes it comes with the person saying, I'm fine, when really they are not fine, or you yourself saying, I'm fine, when really you are not fine. So today's video, we're going to talk about antidepressants. It is that time of year where people tend to present with something that we call seasonal affective disorder, or SAD, meaning that just with the change in weather, I live in Texas. It's cold, dare I say. Don't come for me if you're in New York, Colorado, but it is cool for us. But just, the vibe and the atmosphere is a little bit more gloomy. And people tend to present with more depression this time of year than other times of year. And so I really want to talk in plain language about the medications that are used to treat depression. I want you to understand the differences between when we talk about using SSRIs, SNRIs, NDRIs, and all the other options, plus things like therapy and how that can be helpful, and also really just break down what are the brain chemicals that affect mood and how are the medications working on those. So, hello, my name is Dr. Wallace-Gay. If you are new to my channel, I am a primary care clinical pharmacist. I'm also a medical educator. I teach medical students, pharmacy students, nursing students. And here on my YouTube channel, I focus on helping you think, ask, and act like the CEO, the person in charge, the person at the center of your health care and of your medications. And my goal is to really break down medications and topics in simple, plain language, so that hopefully you feel a little bit more empowered to have conversations and feel a little bit more confident in the medications that you're taking or medications that you may want to stop taking. And I do want to make a quick note. This is an educational video, just like all the others. It's not personal medical advice. If you are in a crisis, or if you are feeling like you can harm yourself or someone else, please call 988 in the United States. That is our local, or that is our national phone line. You can also call your local emergency number as well. So just keep that in mind. Now, I want to start here and just say, with anything that I talk about, I like to put the caveat in that we need to focus on non-medication related things as well. Yes, I am a pharmacist. Yes, I am all about the medications, but I'm also big on making sure that you find something that works for you and implementing non-medication strategies first. So for some people, that looks like only needing therapy. For some people, they may not gravitate towards therapy and they only need medication. But for a lot of people, that might be both. That might be therapy and medication mixed together just for a certain season, for a certain period of time. A really close family member of mine was diagnosed with a really debilitating medical condition that put them out of work. They just weren't able to function and do the things that they were normally able to do. And they suffered from depression for a period of time with that. And so for a while, they were on an antidepressant and really just using the support of psychologists and family and friends as well to talk through that. And now they're no longer on those medications, still using family support and things like that, but just really gotten to a place where they're able to cope and their brain chemicals are back at a normal, steady state. So I just want to normalize, the piece of this that is talking about therapy. And let me tell y'all, I recently started with a new therapist, and we have only had one session, and he is absolutely awesome. I use a platform called Headway, I think. Obviously, it's not sponsored, but I used a platform called Headway to find him. And I had a therapist before him right after my daughter was born. She was great as well. And these were both virtual visits. But she went on vacation. During that time, I found out I was pregnant with my second kid, and I never rebooked the appointment and just kind of kept going through. And then recently, I found myself just kind of like overwhelmed in a moment that put me kind of beside myself. And I was like, your girl needs to go talk to somebody again. So I am back talking to the therapist, really just to help make sure that I have the tools that I need. If I get into a situation where I'm feeling like somebody needs to come put out a fire, I can put that fire out myself, or, not even let it get to a fire, and really just have somebody to guide me through what language to help, talk myself through certain situations or talk through with the person that I am, in a situation with. So just know that therapy isn't just sitting down talking with somebody. It can teach you how to really name your emotions, how to not spiral through situations, how to set clear boundaries without feeling guilt about it. I just had a long conversation with one of my sorority sisters about that recently, about how she needs to set some more boundaries and not feel guilty about it. But also how to break old patterns, how to respond instead of react to things, and really just give you the skills and the tools that you need for that. And of course, medication can help turn the volume down in your brain well enough so that you actually feel good enough to use those tools that you've been given by the therapist. So I think a good kind of simple way to say it is that therapy is going to help you acknowledge and build the tools that you need. And the medication is going to help you with the bandwidth that you need to actually utilize those tools. All right. So that's a long intro. All that to say, let's get into the drug stuff. And as we go into the medications, I want to talk about the most common brain chemicals that we have. And in order for us to really understand those brain chemicals, you need to know that we've got what we call neurons in the brain. So I'm going to, put those up like this because you've got a pre-neuron and you've got a post-neuron. And each pre-neuron releases certain chemicals that are then taken up into the post-neuron to go throughout the body and do what it needs to do. Or oftentimes there are transporters on the pre-neuron that will take up or take back in those chemicals. So it releases chemicals. Some of them go to the post. Some of them are taken back into the pre. Now, in order for us to utilize those chemicals, they need to stay kind of in that in-between space for a while. And so and they need to be able to go to the post side. So we like to inhibit or stop the pre-neuron from taking those chemicals back in. And I'll come back and talk about that again in a moment. So I want to talk about some of the more common brain chemicals that you're going to hear about. One of the first ones, and a big one, is serotonin. You hear people say all the time, your happy neurotransmitter, your happy chemicals. But really, serotonin it's not really a happy chemical. It's more of a mood stability. It's more of a calm, emotional balance, better described as contentness, a contentment type of chemical. And so it affects that calmness and emotional balance that you need to have. It also affects sleep, appetite, digestion, and even sexual function. So serotonin plays a lot of different roles within the body. So we want to make sure that it's at an appropriate level that we need to help us function well mentally, as well as for other things throughout the body. And then we've got a chemical called norepinephrine. Norepinephrine is like our get up and go chemical. It's the one that helps us with energy, alertness, that mental clarity and focus that we need. And it's also what we use when your body responds to stress. So that's norepinephrine. Energy, alertness, focus, get up and go, executive function, making decisions, those kind of things. Norepinephrine helps with that. So again, serotonin is kind of our steadiness, contentment chemical, and norepinephrine is our get up and go chemical. And then we've got dopamine. And dopamine, people talk about how you get a dopamine rush with certain drugs. It gives you a burst of dopamine, or even scrolling through Instagram or YouTube or whatever, those quick bursts of dopamine. So this can be your motivation, your pleasure, your drive, your reward system chemical that just helps foster and build that reward part of your brain. So oftentimes when dopamine is low or out of balance, people will say that they don't enjoy doing things anymore. They can't just like get started with an activity, or they feel flat, just like, numb, because they don't have the levels of dopamine needed for that motivation or that pleasure or that drive. So those are the main three: norepinephrine, serotonin, and dopamine. We also have glutamate and GABA. And glutamate is the go signal in the brain. It just, again, helps everything go. And GABA is our calming or break signal or chemical in the brain. And that's really all I'll say about those, because we talk more about glutamate and GABA with anti-anxiety medications and anti-seizure medications, but not as much with antidepressants. So I won't spend a lot of time on GABA and glutamate. All right, so those are the chemicals that we're working with. And just know that, like with any other part of your body, your brain and the chemicals that help it function and flow and do all of the things that we do throughout the day can have a hiccup. It's just like breaking or spraining an ankle. Like, you can have a temporary hiccup in how things are functioning there, and it's okay to use a medication to help get that back into alignment or back into balance, just like you would use a pain medication to help alleviate the pain while your bones are healing or your muscles are getting back to normal. So before we go into picking a med, we have to think about some safety checkpoints, because one thing that we think about as clinicians is, are we just dealing with depression, or could this be bipolar? This is something that really matters, because if a person is dealing with bipolar disorder, certain antidepressants alone can trigger a manic episode. So that would show up like triggering a person to have insomnia or racing thoughts, or starting to engage in risky behaviors and feeling invincible, like it's me against the world type mentality to the extreme. And we don't want to do that. We don't want to trigger that. So your physicians, will ask questions to differentiate depression from bipolar disorder. Because again, if it's bipolar disorder, we might give an antidepressant with a mood stabilizer, versus if it's depression, we would just give an antidepressant. So again, just kind of choosing and determining what we need there. And then thinking about how old is the person, because if you have someone who is younger than the age of 18, they definitely should be seeing a specialist for any antidepressants, because the chemicals in the brain really under the age of like 25 are still kind of figuring themselves out. And so sometimes, even if we, have good intentions to go in and help with some balance there for a young person who is struggling with depression, that we may inadvertently or accidentally throw that balance off a little bit more. So we have to be very careful and closely monitor and follow with younger people who are needing medications for their mood, and in this case, depression. And then lastly, I just want you to know that antidepressants aren't addictive, but people do sometimes have withdrawal symptoms or withdrawal-like symptoms if they stop them abruptly. So you have to know that, number one, it takes a little while for these medications to work, because we are affecting the chemicals in your brain. So it's not like you're going to take it today and then feel awesome tomorrow. It's going to take a few weeks. So I usually tell patients around the 4-week mark, you should start to feel some difference. You might not feel completely yourself, but you should start to feel some difference. But most people, somewhere between 4 to 6 weeks, maybe even 8 weeks, before they can completely feel the full benefit. So around the 4 to 6 week mark, if you are feeling a little bit better, but you're like, I'm just still not there yet, we might increase the dose. If you're around that 4 to 6 week mark and you're like, I feel exactly the same, this is not helping, then we would take you off of that current medication and maybe switch you to something else. And antidepressants are tricky, because you can, try 2 different medications in the same class. One does nothing for you and the other one works wonders. So, it's kind of a trial and error sometimes. And so I just would challenge you to try not to get frustrated, because it does take a little bit of time and sometimes some trial and error before we find the medication that works really well for you. But I started this with saying, don't stop it suddenly. No matter what, don't stop it suddenly. If you're on a lower dose, we might just take a couple days to taper you off of it slowly. If you're on a higher dose, or if you've been on it for a long time, it may take us a little bit longer to kind of piecemeal down off that dose, just to make sure that your body doesn't have withdrawal-like symptoms coming off of that. And those withdrawal-like symptoms can look like dizziness, kind of having like flu-like symptoms, brain zaps where you just feel like kind of foggy and icky in the brain. It's hard to describe, but they are called brain zaps. And also irritability are things that you might see. And that could come even after just missing a dose. So even though you didn't like intend to abruptly stop it, you missed a dose or you missed 2 days because you went out of town and forgot your pill bottle at home, whatever, you might start to feel some withdrawal symptoms. So just keep that in mind. All right, so let's talk about the families of antidepressants. Now, I want to start with SSRIs. These are selective serotonin reuptake inhibitors. So let's go back to those neurons. And we already know what serotonin is. It's our content hormone. It's the one that keeps us calm and balanced. So with SSRIs, we are preventing or inhibiting the reuptake of serotonin. So once that pre-neuron releases serotonin, we are going to allow the serotonin to stay out in the brain space or in the what we call the synapse. We allow it to stay out there a little bit longer so that it can actually go forth and prosper and do for us what we need it to do, which is to help us to feel that calm and that balance. So some of the selective serotonin reuptake inhibitors or SSRIs that you might hear about are things like sertraline, which is the brand name Zoloft, S-citalopram, which is Lexapro, fluoxetine, which is Prozac, that one's my favorite, citalopram, which is Celexa, it's very similar to Lexapro, and paroxetine, which is Paxil. And there are a few others out there as well, but those are some of the common ones. And so again, these are going to help you hold on to serotonin longer. This is going to help improve your mood. These are also used for anxiety. This video isn't about anxiety, but just know that you might be starting on one for anxiety, and they tend to work a little bit quicker in anxiety. So you might see some benefits in a couple of weeks, but just know that they can be used for mood, depression, as well as anxiety. So they're really good for someone who has, both depression and anxiety. They're good if you're struggling with panic attacks. Some of the SSRIs are used in OCD, as well as for some symptoms, sometimes in PTSD. So they're used for a multitude of reasons. One of the main ones being mood or depression, as well as anxiety. Not a lot of side effects with them, but some of the common ones are nausea or just kind of general stomach discomfort, headache, some sleep changes. And I tell people, just kind of depends on the person. Some people tend to feel stimulated, like they're a little more wired when they take them. And some people tend to feel like lethargic and they're a little sleepier when they take them. So take it. If you're prescribed it, take it. See how you feel. If you're feeling a little wired, then you might be someone who needs to take it in the morning. If it makes you feel sleepy, then you're someone who probably needs to take it at night. And if either of those things is the extreme, then that's something that you need to have a conversation with your provider about. Sexual side effects. So lower desire, sometimes trouble completing your sexual experiences. So if you're experiencing that, we can definitely switch you to something else if that's something that you're concerned about. And then some of them have some weight changes over time. The reason why I like fluoxetine a lot is because it has a longer, what we call half-life. That just means it hangs around longer in the body. And so sometimes this can be easier. If you do miss a dose, then those withdrawal-like symptoms won't pop up as quickly because you still have the drug kind of lingering in your system for a little bit longer. Paroxetine or Paxil tends to be a little more sedating than some of the other ones. And the withdrawal symptoms can be sometimes a little more impactful if it's stopped abruptly. So just keep that in mind. And then citalopram and S-citalopram. So that was Lexapro as one of the brand names, as well as Celexa. These medications just need to make sure that we use them cautiously, especially if you have any heart issues. So we may check an EKG before we start you on it. There may be some dose limits depending on your age. We're not going to go above a certain dose, but I mean, it's a pretty clean and simple drug. It's just that we have to be cautious about it with any heart concerns. Okay. Then we've got our SNRIs, Serotonin-Norepinephrine reuptake inhibitors. So we've got our pre and post. Now we are allowing both serotonin and norepinephrine to hang around longer and not be taken back up into that neuron. So some examples of this are venlafaxine, which is Effexor. Not my favorite. I mean, if it's working for you, keep going. But it can sometimes increase the blood pressure, and I tend to treat a lot of people that also have high blood pressure. So that's why I don't gravitate towards it. But then we also have duloxetine, which is Cymbalta, and we have a medication called desvenlafaxine, which is the brand name Prestige. So these medications, again, support allowing both serotonin and norepinephrine. So we get both the mood benefits as well as the energy and focus benefits that some people need. Now, how are we differentiating between using an SNRI versus an SSRI? Again, if you're someone who has depression plus fatigue and low energy, that norepinephrine piece with the SNRIs might be beneficial. So something like duloxetine might be a good choice. Also, if you have certain pain conditions like neuropathic pain or nerve pain, then our SNRIs also have good benefits for that as well. So if you're someone who is struggling with neuropathic pain as well as depression, then we could give you something like duloxetine and that should help. And also if you're someone who just doesn't respond well to any of the SSRIs, then we can switch you to an SNRI, and oftentimes that does really well. So in terms of side effects, the stomach stuff, the sleep stuff, the sexual side effects are similar with SNRIs, just like with SSRIs. You might have sweating. I talked about the increased blood pressure. It can happen with any of them, but it's more common with venlafaxine. So just watch out for that. And then, I think duloxetine specifically is just a really good option if someone's like, I'm depressed and also I'm in pain, specifically chronic pain or nerve pain. All right. And then the last main one I want to talk about is our NDRI. So N, norepinephrine, D, dopamine, and then RI is reuptake inhibitor. So we're inhibiting the reuptake of norepinephrine and dopamine with a medication called Bupropion. And the brand name for Bupropion is Wellbutrin. And Wellbutrin, again, is going to support both norepinephrine and dopamine. So this is going to help with energy, motivation. These have less sexual side effects because it's not really working on serotonin, which is kind of what is one of the main culprits there. But it's also going to help you with just focus and motivation overall. So we tend to gravitate towards Wellbutrin for people who have low energy, they're not motivated, they're having issues concentrating. Maybe they've had the sexual side effects with the SSRI or SNRI. And also, one of the big ones is if they're trying to quit smoking. Bupropion is approved for smoking cessation to help you quit smoking. So that dopamine reward rush that you get from nicotine after smoking, we can replace that by allowing your own dopamine to hang around longer with something like Bupropion. So if you need to quit smoking and you need some mood support, this is a great option for that. And then also keep in mind some side effects. So if anybody's feeling anxious or jittery or having insomnia, just know that Wellbutrin can sometimes be activating. It can also reduce appetite and lead to weight loss. So you might also notice, although we're using the GLP-1s a lot, bupropion is a component in a specific weight loss medication because it can help with reducing appetite and weight loss for some people. So there's a combination product out there for weight loss that has bupropion in it. It is not going to be something that we use for individuals who have a history of seizure disorder, just because it lowers that, we call the threshold for having a seizure. And so we don't want to do that. So if you've ever had a seizure, I tend to stay away from it, even if you had a seizure a really, really long time ago. And then if you have certain eating disorders, the risk for that goes up. So, because this is helping reduce appetite and can cause weight loss, if you are someone who has had an eating disorder in the past or currently struggling with eating disorder, we don't want to give you this medication. There's a medication called Mirtazapine. The brand name is Remeron. This one is also used for depression. It's lower down on the list of ones that we choose, but specifically if someone is having issues with sleep and also they are having issues where they're not hungry, Mirtazapine is a good one because it helps stimulate appetite and it helps make you kind of drowsy and sleepy. So it can be a good option for those people that show up and they're like, I can't sleep and I'm losing weight because I'm not eating and I'm anxious at night. This is going to be a good one for that. All right. And then I just want to mention trazodone. So I'm not going to talk a lot about trazodone because we very seldom use it right out the gate just for mood, but it is an antidepressant that can be used. But more often than not, we are using it at low doses for sleep. So if someone has insomnia as a part of their depression or anxiety picture, it's a good add-on to another antidepressant to help with the sleep component of that. Or even if you don't have depression, we can sometimes add it on to help with sleep. Some of the side effects that you might see: grogginess, dizziness, especially if you stand up too fast, you can get some dizziness. But generally speaking, it's pretty, simple and easy to use. And again, often used for sleep. And then final note on medications. We do have two older classes: tricyclic antidepressants, things like amitriptyline, nortriptyline, as well as MAOIs. And these are things like selegiline. I hesitate to even mention them because I know we're not using them as much. But if anybody's watching this video and they're like, I am on this medication and she didn't talk about it, I just want to bring it up. So these are older families. They work really well, but because they're older, hadn't quite gotten the side effect profiles down yet. They do have a few more side effects, a few more drug interactions. And so for that reason, we typically don't use them first line. I will say with the tricyclic antidepressants like amitriptyline, you do tend to see dry mouth, constipation, sleepiness, sometimes dry eyes, things like that. We might also be concerned about affecting the rhythm of your heart in certain people who already have some heart concerns. And then MAOIs, they just have several food interactions. This, again, things like selegiline, lots of food interactions with them that just makes it complex to use them. They have a lot of guidance and oversight required. So we're not using them very often, but I wanted to bring them up. And then there are some newer options. There's a medication called vortioxetine. The brand name is Trintellix. So this can be used for individuals with depression. And then there's another drug called Vilazodone. The brand name for it is Fibrid. And so, for some people, they tolerate these better. They may be a little bit more expensive because they are still fairly new. You can only get the brand product and not the generic. They're not that much better than the other agents. They're just working a little bit of a different way. And oftentimes we might use them for, people that don't respond well to SSRIs or SNRIs. And then if you're someone who has very severe treatment-resistant depression, you've tried all the things, you've done multiple drugs together, still not working, you're going to therapy, you're just doing all of the things, you might hear people talk about using ketamine or esketamine, and really more so in specialty settings. So in my practice setting, primary care, we're not passing out ketamine. It just needs a little bit more supervision. And usually under a psychiatrist, consultation and discussion. So just know that that's an option. And I already mentioned earlier that picking an antidepressant is very finicky. It's about matching the medication to the person. Like, are you dealing with anxiety and depression? Are you trying to quit smoking and you're depressed? You have pain and you're depressed? Are you having sexual side effects on one medication? Did you try this medication and it wasn't working? So we have to go through a little bit of a trial and error sometimes. And oftentimes, too, we start something and it works really well for a person. They don't have issues on it. So it can go both ways. But if you are on one and it's not working, please try something else. Please advocate and go ask to be switched to something else. When you go to your appointments, be honest and let them know if you're not feeling well. And, you don't have to kind of psych yourself into like, I think I might be feeling better, or maybe I'm not, like I should be. You could be on a medication that's just not doing it for you. And so for that situation, we would want you to switch to something else. Final note, if you don't take anything else away from this video, I want you to take away that mental health matters. This time of the year can be difficult. Holiday season coming up. It's just a lot of stress along with the environment and all the things that come with end of the year. So if you need support, just know that therapy, medication, or both are available. And just means that you're human. And let's use them, and let's use them safely. And if you really want a simple way to take control of your meds, map them all out. I've got to tell y'all, grab the free medication mind mapping guide. It's going to be in the description box below. It's going to really help you organize what your meds are for, how you take them, what are your side effects to watch out for, what questions you need to ask at the next visit. Because listen, we get to those appointments and cannot remember questions or what the right questions are. If you don't ask the right questions, you're not going to get the right answers. So this starter guide really helps you walk you through that and map out, okay, I'm dealing with my mood. What are the medications that I'm on? How do they work? What are their side effects? Who's prescribing this? What are some questions I need to ask? All of that in one document. So please download that. I think it will be helpful. And if you have any questions or comments for me, please let me know. If you've ever been surprised by what depression or anxiety looks like or how the medications work, and you want to tell me about that, drop a comment in the box below as well. And that's it. I will see y'all in the next video. And if you have any suggestions for videos you want me to prioritize, please do. I've got a whole list of drugs I can't wait to tell y'all about. But yeah, just let me know. Like, subscribe, and share this video as you go on your journey to become the CEO of your own meds. See you next time.